So hello guys, welcome to our channel. Today we are going to discuss about the microbiology rapid revision. So in this we will be covering the last year and previous year topics of the Fmge. So those who are interested to have these notes, you can join from the Telegram group and you can avail this. So let's start the discussion. So first we will be discussing about the microbiology and the contributions of the different scientists, and one among them is Dr.Bharath. He is have contributed from the many more microbiology and discoveries, and also some of the most important drugs such as methotrexate and also tetracycline and DEC, which we commonly use for the filaria. And also he is the Ignace Semmelweis, which we pioneer of the hand washing and the hand hygiene, which was discovered in the early years, which was not popular and ignored by the many historians, but later on as the discoveries such as germ theory. So germ theory was given by the Louis Pasteur and later was adopted by the many other scientists, and also the hand hygiene was became the one of the preventive measures for the microorganisms. So let us know about the some of the motility. So in the motility, listeria, which will be showing of the tumbling motility, and also it will be showing the differential motility. So in the differential motility, we will be seeing at 37 degrees it will be active, and at the 22 degrees it will be inactive. Next, trichomonas is going to show the twitching motility. Giardia, it shows the falling leaf motility, and syphilis will show the corkscrew motility, and Proteus and the Clostridium, which will be showing of the swarming motility, and Vibrio cholera shows the darting motility. These are the some of the important motilities that has to be taken note. And next, coming to the sterilization and the disinfection. Sterilization, which will be killing the spores also. In the disinfection, the spores are not killed. Okay, only in the high level settings, the disinfection mostly kills the different types of the organisms, even the spores also in the high level. And sterilization will be in the two types. One is the physical method, another one will be the chemical methods. So in the physical methods, we have the heat, which is commonly used, moist heat or the hot air heat, and then also radiation uses the gamma rays, and then we also have the in the heat itself the moist heat, which will be showing the hot air oven, and dry heat will be showing the hot air oven, and also the moist heat will be showing the autoclave. Next, coming to the chemical methods, ethylene oxide, aldehydes, and halogens, or the halogens, which will be commonly used in the different types of the microbiology settings. And sterilizations have the each and everything will be having the importance of the controls. Let's see one by one. So first, moist heat. In the moist heat, autoclave used for the all the surgical instruments commonly, and also cultures, glass, and the temperature that is used for the autoclave is the 121 degrees Celsius for 15 minutes at 15 psi. The control that is used for here is the thermophilus. Okay, this will be used here as a most commonly Bacillus thermophilus is used, and if you want to kill the spores, it will be around 134 degrees Celsius for 20 minutes. This is used for the except catgut sutures, whereas catgut sutures are used in the radiation. Here catgut sutures are used for the radiation. Around this will be used with the help of the gamma rays, and the control there will be Bacillus pumilus radiation. Next, also coming to the plasma sterilization. For the plasma sterilization also the control will be Bacillus thuringiensis. And for the ethylene oxide used for the different scopes, and for this we are going to use the control as a Lobg ethylene oxide, and mostly here we use for the lung and heart missions, for the sterilization of the lung and heart missions. Next, aldehydes. Aldehydes is classified as a high level disinfectants. These are used as a high level disinfectants and used for the different flexible endoscopes. Flexible endoscopes, this is used. Whereas liquid cultures, for the liquid culture, it is used by the incipation, and then some of the powder or any other gloves, dust, these all will be used by the hot air oven. This is considered as a dry heat. Hot air oven is used for that. Next, for the syringes is also used gamma rays. These are the some of the important of the sterilization and the disinfectants. And for the blood spillage, use the sodium hypochlorite. And if there is a mercury, it has to be taken in the syringe. For the soiled hands, commonly we can use the isopropyl alcohol. Alcohol can be used for this, right? Next, moving on to the differences between the what is a gram positive and the gram negative. The most difference between the gram positive and the gram negative will be the lipopolysaccharides. So lipopolysaccharides which will be present in the gram negative, and here in the gram positive we will be seeing that teichoic acids. Teichoic acids is present, and thick peptidoglycan membrane will be seen, and here it is the thin peptidoglycan membrane. And on the gram stain, the gram negative will be pink, and on the gram stain of the gram positive will be blue or purple. So how this gram stain will be performed? So basically there will be a 4 steps. So first the primary stain is added, followed by the mordant, and most important the decolorizer. It could be acetone or it can be alcohol. And this is the most important one which will be differentiating between the positive and the negative. And the last one is the counter stain, can be used by the carbonyl fusion or the saffron. And what is the first step we are going to use? Crystal violet. And the second step iodine. Third step will be the alcohol and the acetone. Fourth steps will be the saffron. And opposite to this, we are having the Zn stain or the AFB stain. And on the AFB stains, the first stain will be the most commonly the same fourth step we used. Here we are going to use the carbonyl fusion. Carbonyl fission will be used here, and followed by in the second step, instead of the mordant of the iodine, we use here is the heat, and then H2SO4 as in decolorizer. Then finally we are going to use the common one which will be giving rise to the different color. Okay, that will be used for the counter stain of the methylene blue. For the all the Zn stains, what are the positive for the Zn stains? Nocardia and all the species of the Mycobacterium tuberculosis and Cryptosporidium, Cyclospora, Isospora, Taenia solium, and also Echinococcus. These will be the positive for the Zn stain. Next, coming to the classification. So, coming to the mostly important of the growth curve of the bacteria. So first phase is the lag phase. There is no increase in the number of the cells, but there will be a maximum division. Here you are going to see the maximum division. And in the second phase is the log phase, where the exponential number of the organisms and the cell bacteria will be multiplied. and in the stationary phase is a Placi number, and here the rate of the cell division is roughly equal to the death, and whichever if you want to use, there is a spores formation is also seen in the phase of the stationary. And while the decline phase, you are going to see the endotoxins, and this is a decreased exponential growth of the all the bacterial cells. And question where we can test the antibiotics can be tested at the log phase. In the log phase we can test for the different types of the antibiotics. Next, what is the difference between the exotoxin and the endotoxins? So exotoxins can be gram positive also and gram negative also, whereas endotoxins is only produced by the gram negative organisms. So common examples for the exotoxins are the strep and also staph. Right, these are the common examples for the exotoxins produced by the strep and staph, and it will be the protein toxin. This is the protein toxin, whereas the endotoxin is a non-protein, and mostly it will be consist of the lipids, same as its cell membrane, which is contains of the lipid polysaccharide, right? So that will be present in the endotoxins, and this will be the heat stable exotoxin and heat labile of the endotoxins of the gram negative. Next, some of the important toxins. If there is a 60S protein synthesis is decreased, common organisms will be Shigella, which will be causing the dysentery, and next E. coli. In the E. coli, there is a special Shiga-like toxin that is used here. Next, CAMP. If there is a disturbance of the CAMP, mostly this is due to cholera and also pertussis, anthrax, and M for this is, you can remember, like E. coli, and this is a labile toxin. And CGMP. CGMP is for the E. coli, but the organism will be stable organisms. Next, neurotoxins, botulism, and tetanus. Tetanus will stop the glycine and GABA inhibition, whereas botulinum is going to show for the acetylcholine. Okay, so these are the difference of the neurotoxins and the different protein synthesis organisms also we have discussed. Next, moving on to the some of the important points such as capsulated organisms. What are the capsulated organisms? So capsulated organisms such as Pseudomonas, Streptococcus pneumoniae, H. influenza, and Neisseria species. Next, spore forming organisms. Spore forming organisms are Clostridium and anthrax. Obligate aerobe is MTB, whereas obligate anaerobe actinomyces. Right, this is the some of the important points of the general that we have discussed. Next, moving on to the culture medias. So culture medias, we have the simple media used for all types of the organisms. This is for the all the types. Next, enriched media, enrichment media. Enriched media is a solid type, whereas enrichment will be the liquid type. In the enriched media, all the organisms will be seen. In the enrichment, mostly the commensals, whatever the commensals are unnecessary organisms, that will be dead, and only whatever we wanted we can look for in the liquid test. Right, in the liquid test also we are going to see the salmonella, like alkaline we use, that is for the cholera, and the salmonella broths we use for the like tetratriode the one which we use for the salmonella. And next we also have the selective media, only for the selective, such as gram negative or the gram positive only. And next we also have the nutrient agars as part of the simple agars. Next, what are the examples? Some of the important examples: lactose fermenters, right? Lactose fermenters, which will be differentiating between the E. coli species and non-E. coli species, right? And also Lowenstein Jensen. This is used for the MTB. Loeffler serum. Loeffler serum is used for the Corynebacterium diphtheriae and other species we use. And then we also have the Bayes agar. So Bayes agar is used for the Legionella. Bayes agar is used for the Legionella. PPLO, this is used for the Mycoplasma. Next, Robertson cooked media. Robertson cooked media. This is used for the species such as Clostridium. All the Clostridium species can be used this way. Next, CAMP test. So one point, that is a CAMP test, that is used for the GBS, whereas reverse CAMP test is used for the Clostridium perfringens. Next, hemolysis. Beta hemolysis, which will be the complete hemolysis. Alpha is only partial hemolysis, whereas gamma, there is no hemolysis at all. Alpha hemolysis, one of the examples will be the strep viridans and also strep pneumococcus. Beta hemolysis, Staph aureus and also streptococcal pyogenes, GBS and also group A hemolyticus enzyme also that will be seen. Partial hemolysis, there is no hemolysis will be seen. It could be enterococcus. These are present for the enterococcus species. And Thier-Martin is for the Neisseria species, Neisseria gonorrhea or Neisseria meningitis. Chocolate medium used for the Haemophilus species. Next, moving on to the bacteriology, the main classification for the gram-positive bacteria, Bacilli, cocci are in the branching. In the branching, the aerobes are the nocardia, which is the acid positive, and anaerobes will be the actinomyces. Next, bacilli also divided into the aerobe and the anaerobe. Anaerobe is the Clostridium and also the acne causing Cutibacterium. Next, aerobes are the Listeria, Bacillus, and the Corynebacterium. Next, for the cocci, we are going to test with the catalase and the coagulase. If it is a catalase positive, it is a Staphylococcus aureus, and coagulase positive. Both the test, catalase and the coagulase positive, is for the Staph aureus. If it is a coagulase negative, then it could be Staphylococcus epidermidis or the Staphylococcus saprophyticus. Next, streptococcus is divided into the based on the hemolysis. Just now we discussed, if it is a partial hemolysis, it could be viridans or the pneumonia. Complete hemolysis, it could be agalacti or the pyogenes. No hemolysis at all, then we are going to check with the 6.5% of the NS here, whether it is a strep bovis, is a colon carcinoma pathogen, or it could be enterococci, which has enteralis facium or the fecalis. These are the some of the examples for the gram-positive organisms. Next, moving on to the organisms and their particular causes. So, Streptococcus pyogenes is most commonly associated with the pharyngitis. And post-pharyngitis, the complications will be post-streptococcal glomerulonephritis or acute rheumatic fever in the children. Next, Staphylococcus aureus. Staphylococcus aureus is the common pathogen for the osteomyelitis. This is the common pathogen for the osteomyelitis, abscess, hospital acquired pneumonia, native wall endocarditis, native wall infective endocarditis also, and tampon associated toxic toxic shock syndrome also. These are the common pathogens, and also post-operative infections is also most commonly associated with the staph aureus. Next, Streptococcus pneumoniae. Streptococcus pneumoniae, which will be commonly causing the meningitis in all age groups, and also it can cause the pneumonia. Community acquired pneumonia is most commonly bacterial due to Streptococcus pneumoniae, and also otitis media that will be seen in these patients. Next, moving on to the different types of the diseases. So this is the anthrax. Anthrax is considered as a bioterrorism agent. Bioterrorism agent. It could be two types. One is a cutaneous type, or it could be pneumonia, lungs related. Pneumonia disease is known as a wool sorter, whereas cutaneous type is known as a black Fisher Hyde-Potter disease. This is associated with the Hyde-Potter disease. And the symptoms will be severe hemorrhagic pneumonia. And for the cutaneous type, there will be black Fisher will be seen. And this is highly infective. So the spores that is produced by the anthrax is highly infective. And anthrax contains the specialized capsule that is known as a polypeptide. It contains the polypeptide, and two genes will be present, PXO1 and PXO2. PXO1 is for the toxin, whereas PXO2 is for the capsule, and highly infectious agent of the bioterrorism agent. Mostly on the gram stain, you are going to see the Chinese letter pattern. Sorry, this will be the bamboo stick appearance, Medusa head appearance, fir tree appearance. This will be seen on the gram stain of the anthrax. So this is how the most commonly Fisher skin cutaneous lesion will be presented by the anthrax. And other things, the mostly for the treatment, we can give the streptomycin. Next, coming to this picture, so this is a hypotonia, and this is caused by the botulism. So the difference between the botulism and tetanus. So this the history will be mostly the patient is had the ingestion of the canned food, and here the history will be patient is having the road traffic accident and wounds, right? The botulinum toxin, which will be going to inhibit the acetylcholine. So acetylcholine is an excitatory, so the complete tone will be disturbed. So patients will be presenting as a flaccid paralysis. And whereas tetanus is going to block the GABA plus glycine. So these are inhibitory. If the inhibitory is blocked, then the tone will be increased. So the patients will be presented as a spastic paralysis. And commonly the drugs we are going to give is the toxin and also metronidazole. Same as here, treatment will be toxin and metronidazole. So media that we already discussed, we are going to use the Robertson cooked media. Next, this is the Clostridium perfringens. Clostridium perfringens. So it can cause the Melanese gangrene or gas gangrene. It contains the specialized toxin that is known as a alpha-lecithinase. And remember with the mnemonic of the NTR, so first this is the Nicholas reaction is positive, target hemolysis and also reverse camp test. Even in the putrefaction of the dead body, the organism that will be positive is a Clostridium perfringens. Next, here comes the Corynebacterium diphtheria. Corynebacterium diphtheria, which is associated with a severe upper respiratory tract infection. It can even involve the myocarditis and also larynx. Severe stages, it can also involve the neural, such as nerves. And on the gram stain, you are going to see this Chinese letter appearances. It can be also known as a Hens granules and bipolar metachromatic granules. So highly infective with the respiratory droplets. Drug of the choice is the erythromycin. This is the Corynebacterium diphtheria. And next, let's see the types of the Rickettsia species. So this is associated with the different types of the vectors, right? So typhus fevers are the three types, that is a Rickettsia prowazekii. This is caused by the lice, and Rickettsia typhi is due to murine typhus, that is due to fleas, and Felis is due to typhus like it is also associated with the fleas. Next, Rickettsia this is associated with the Rocky Mountain spotted fever with a tick bite, and Prakari is due to typhoid fever with the ticks also, and Australis also is the Queensland tick fever, also known as a Q fever, which is commonly associated with the ticks. And next, Orisha Shishugamushi is a scrub typhus. This is due to mites, and also the other scrub typhus is also due to mite cause only. Right? These are the Rickettsia species and their vectors. And next, coming to the E. coli
These are the
species.
important
In the E. coli
points
species,
and
there are
the
the
diseases
five
that we
types of
have
the
to remember in this condition. Those who are new to
gastrointestinal
this channel, please do
agents.
subscribe.
One is the enterotoxicogenic E. coli. This is associated with the traveler's diarrhea. This will be seen as a traveler's diarrhea. Next, entero-invasive E. coli. This will be commonly with the presentation of the dysentery. Blood pus will be seen in the patients, right? And also it can involve the colon invasion. Next, enteropathogenic E. coli. Enteropathogenic E. coli will be seen with the dysentery. It is also seen with the dysentery, and it will be caused by the attachment or effacement of the epithelium of the GI system. Enteroaggregative species of the E. coli. This will be seen in the HIV patients or severely immunocompromised patients. Enterohemorrhagic, this is the one which we have just discussed. This is Shiga-like toxin, and the species are 0, 157 and H7 species, and it can be presented with the hemolytic uremic syndrome and also dysentery. The toxins which will be causing the hemolytic uremic syndrome, and this is known as a satellitism. Satellitism which will be positive for the Haemophilus influenza. Haemophilus influenza can cause meningitis, it can cause the epiglottitis and also pneumonia. The two important points of the Haemophilus influenza, it will be contents of the factor 5 and factor 10. Factor 10 is for the hemin Factor 5 is for the NAD, that is for the Haemophilus influenza. And this green color colonies is due to pyocyanin, and this agar is known as a cetrimide agar. And this is Pseudomonas, which will be showing of the green color colonies, green nail syndrome, Shanghai fever. All this will be associated with the Pseudomonas. And cystic fibrosis patients also in the severe stages or the recurrent infections will be positive with the Pseudomonas type of the infections only. And drug of the choice specifically for the Pseudomonas can be given as a piperacillin. Tazobactam can be given for these patients. Next, what is the most common causes of the meningitis in neonates? In the neonates, it is associated commonly GBS and E. coli in India, GBS worldwide. And other species can be Listeria, Neisseria, and H. influenzae. These are the meningitis patients. Next, CSF analysis also commonly asked. So different types of the how to recognize. So in the bacterial, most commonly there will be increased neutrophils, whereas in the tuberculosis, increased lymphocytes. So in the tuberculosis, you will be seeing the high protein and low glucose, and in the bacterial also same with the high protein and the low glucose, but the protein is only mildly elevated. Severely elevated is seen with the tuberculosis. And also cobweb formation is seen with the tuberculosis. Bacterial will be turbid color of the CSF analysis will be seen. And culture positive, most commonly this is for the streptococcus, and tuberculosis is the chronic type. Lymphocytes will be commonly associated. So the difference between the Neisseria meningitis and also other differences between the Neisseria gonorrhea. Neisseria meningitis can be fatal, commonly seen with the young adults and army camps, and highly infectious also. It will involve the meningitis plus rash that will be seen. M for meningitis, and it is present with the maltose activity, maltose fermenter. So next, for coming from the gonorrhea, this is the most common cause for the urethritis, will be seen here, and also it can cause the complication like adrenal hemorrhage. Adrenal hemorrhage will be seen. And in the severe stages of the urethritis, if the pelvic inflammatory disease is caused, then it can cause the Fitz-Hugh syndrome. Right? This is seen in the perihepatitis. And G for gonorrhea and G for glucose fermenters. This will be the glucose fermenters. So drug of the choice for the both is the ceftriaxone. Here also ceftriaxone. Ceftriaxone is given for both. Next, another species like Clostridium difficile. This is due to misuse of the antibiotics such as clindamycin. So it can be also treated with the antibiotics. First, we can start with the metronidazole. Then, if there is no improvement, we can go for the vancomycin. And the last, the drug of the choice will be the fluoxamicin. Is given as a drug of the choice for the patient, right? So these are the some of the species and the important microorganisms that has to be remembered. And let's see some of the examples for the gram negative. So gram negative examples are, we have diplococci. The diplococci gram negative organisms are meningococcus and gonococcus. Next, Oxidase negative organisms. Oxidase positive gram negative organisms are H. pylori. H. pylori is positive for the urease, and cholera is positive for the alkaline, and Campylobacter jejuni is a highly thermophilic. Even at the 37 to 42 degrees it can grow. Next, some of the examples for the cocoa bacilli, both the cocci and the bacilli. Cocoa bacilli. The examples are the H. influenza, and also Gardnerella, Pasturella, tularensis, Bordetella, pertussis, Brucella. These are the some of the species for the both cocoa bacilli gram negative species. Next, the one line that you can remember, all the gram positive are the cocci, all the gram positive are cocci except meningococci, gonococci, Moraxella, right? And all gram negative are bacilli except MTB, Mycobacterium tuberculei, and also Clostridium, diphtheria, Listeria, Nocardia, Anthrax. These are gram negative, gram positive bacilli. Remaining all will be the gram negative only, the different species of the gram negative bacilli. These are the important of the different types of the bacterial infections. Next, moving on to the virology. In the virology, the difference between the DNA virus and the RNA virus. So the DNA viruses are, remember, with the mnemonic of the happy, HBV, HPV, and also difference of the polyoma virus, papilloma virus. These are the common species of the DNA virus, and also adeno, pox, parvo viruses. Parvovirus is a single-stranded DNA virus, whereas pox is the most biggest virus of among all the viruses, right? And also herpes also type of DNA virus. Next, all other will be classified under the RNA. Some of the families that we can remember: pox is the biggest one, parvo is the smallest one, and parvo also contains single-stranded DNA. And reovirus is the type of rotavirus. This is the RNA type, but it will contain the double-stranded RNA. Next, what all belongs to the paramyxo? Paramyxoviridae, you are having the species like measles, parainfluenza, parainfluenza which causes the croup, parainfluenza is also seen, and respiratory syncytial virus, Nipah virus. All these are belongs to the paramyxoviridae. And next, flaviviridae. Flaviviridae will be belongs to the difference of the vector borne, like dengue fever, KFT, and also Zika virus, Japanese encephalitis, and West Nile fever. Togaviridae is for the rubella, retrovirus is for the HIV, retropara is for the HPV, polyoma, this is for the HAV viruses that is commonly associated. And in the flaviviridae, we also have the HCV virus. It is also positive for the flaviviridae virus. And rhabdo is for the rabies viruses. Next, different types of the human herpes viruses we will see one by one. What first one is a human herpes type 1 is classified under the HSV1 and the HSV2. HSV1 is for the oral, HSV2 is most commonly associated with the genital. So most commonly the herpes labialis is a presentation, and here herpes simplex, the genital lesions like vesicles on the genital organs will be presented. The ganglion that is associated here is a trigeminal, and here it is a sacral. Sacral ganglion involvement is the HSV type 2. If it is involves the temporal lobe as a meningitis, it is due to HSV1. If it is a moderate type in the neonates, that is due to type 2 of the HSV. Next, HSV2 is varicella zoster virus. Varicella zoster virus presented with the chickenpox in the children, and if it is immunocompromised, it is presented as a herpes zoster dermatomal rash. HSV3, this is associated with the Epstein-Barr virus, and Epstein-Barr virus which will be inhibiting the B cells, and it can cause the difference of the carcinomas such as lymphoma of the Hodgkin, non-Hodgkin, and nasopharyngeal carcinoma is also seen. And what is the positivity for the Epstein-Barr virus? The test that we can do is a Paul Bunnell test is positive for the Epstein-Barr virus. And here we are going to use the heterophile antigen. Heterophile antigen is used for the Paul Bunnell test of the Epstein-Barr virus. And herpes virus 4, this is for the cytomegalovirus, is most commonly associated with the torch syndromes. Most commonly associated with the torch syndromes. And if you want to test, the best test that we can do is the PCR urine sample that has to be tested for the CMV virus. And it can cause the congenital, especially there will be periventricular calcifications and SNHL, and also glaucoma is associated with the herpes simplex virus. Next, herpes 5 lesions. This is associated with the, and herpes 6 and 6, it can cause the pityriasis rosacea skin condition, and also erythema roseola. The rash is comes after the fever onset. So this is the erythema roseolum, also known as a fifth disease. Herpes 8, this is the Kaposi sarcoma, vesicular purple lesions, and these lesions are commonly associated mostly in the HIV patients and the immunocompromised patients. And next, different types of the organisms like hepatitis A, B, C, D, and E. A is belongs to the picornovirus, B is belongs to the hepadna, and C is belongs to the flavivirus, and D is for the delta, and the hepivirus is for the E. And A is the ssRNA, the B is belongs to the only DNA virus, remaining all of the RNA viruses only. And most commonly, the root of the infections will be enteric by the HSV-A and HSV-E. And remaining the B, C, D, it can be due to the parenteral or the sexual, and it can be also due to blood transfusion. Next, the incubation period will be the 50 days and followed by the 80 to 160 days, and 150 days. The most chronic will be the hepatitis B, and which is associated with the more with the hepatocellular carcinoma, and the chronic hepatitis. The most common will be the hepatitis C, almost more than 50%. And if it is a co-infection or the superinfection, that is associated with the hepatitis D. And coming to the hepatitis serology, HBsAg antigen, this is positive for the active infection. And how can we differentiate? This is the highly infective or low infective, that is the HBeAg. If it is high, that means it is highly infective, and if it is negative or the low, that is a low infectivity that is seen in this patient. right? Next, antibodies that will be differentiated by the IgM is the acute infection, IgG is the long-term infection of the hepatitis. And the drug of the choice for the hepatitis B is the tenofovir, and this is for the sofosbuvir for the hepatitis C. These are the two organisms that will be associated with the conditions. And if the super infections, hepatitis B will be the IgG positive. If it is a co-infection, same hepatitis B will be the IgM positive. That is how we can differentiate between the hepatitis D with the super infection of the chronic infection. Next, different types of the viral inclusion bodies. Types are the intracytoplasmic or the intranuclear. In the intranuclear, we have the Cowdrey type A positive for the herpes simplex, yellow fever, and the varicella zoster. And basophilic are the Cowdrey B that is seen with the cytomegalo or the adenoviruses. Next, intracytoplasmic such as molluscum contagiosum, which will show the Henderson-Peterson bodies, and Negri bodies is seen for the rabies, Gorneri bodies is seen for the smallpox, Passion bodies is seen for the smallpox, and Borel bodies is seen for the fowlpox. And here you can see this is the presentation of the CMV also appearances, and this is the lymphoma, and these cells are known as a Redstenberg cells. Redstenberg cells, and here these are the Negri bodies. Negri bodies is positive for the rabies, and this is the Henderson-Peterson bodies, positive for the molluscum, and this is for the measles. Warthin cells, this is positive for the measles viruses. Next, here the presentation. Here if you see, the most commonly all types of the polymorphic rash, this condition is chickenpox. Next, if you see, the most commonly the lesions, that is involvement of the skin, that is seen with the 6 disease is roseola. Complete erythema rash will be presentation. Next, if it is a slapped cheek appearances, this is the parvovirus B19 species, and this is known as a 5th disease. Also, not only the parvovirus will be infecting this kind of, also it can cause the aplastic crisis, and also it can cause the non-immune types of the hydrops fetalis is also seen with the patients of the parvovirus B19 infections. And this is the presentation of the Kaposi sarcoma presentation seen with the HIV patients. Right. Next, this is the difference between the patients with the measles and patients with the rubeola, German measles. So main differences between the measles and the rubeola viruses is the lymphadenopathy. Lymphadenopathy is more prominent in the rubeola, whereas cough, coryza, and conjunctivitis, that is more prominent with rash, is seen with the measles. Another differentiating will be the Koplik spots. Koplik spots in the buccal mucosa is one of the presentation. And in the rubeola virus, this is also associated with the rash, fever, and in the buccal mucosa, rather than in the buccal mucosa, on the hard palate, which will be presented as a Forsheimer spots. Okay, Forsheimer spots will be seen with the patients of the rubeola viruses. But rubeola can be more dangerous in the pregnancy, especially in the first trimester. It can cause the congenital defects, most severe types of the congenital. What is the presentation of the baby if it is born with the infectious rubeola? Patent ductus arteriosus, SNHL, and cataract or glaucoma will be seen. This is with the presentation of the congenital type of the torch infection associated with the rubeola. right? These are the some of the types that can be remembered. And measles complications, SSPE, this is the most severe and late presentation, whereas acute presentation will be pneumonia and it can cause the death also. And only the treatment where we give vitamin A plus supportive treatment for this measles patient. Remaining almost all the viral infections will be mostly we are going to give the all the infections is commonly treated with the supportive treatment only, right? In dengue patients, there will be four types of the serotypes. There will be four types of the serotypes is present. And first is a mild, but second can be severe because of the antibody enhancement. Antibody enhancement is seen in this patient. The test that we can do in the physical examination, that is a tourniquet test, where you are going to see the patients with the rash. And here also treatment is mostly normal only, and but if it is supportive treatment only, but if it is land into the shock, then the continuous IV fluids which will be given along with the fever control. And you are going to do platelet transfusion only if it is 10,000 platelet. Until then we are not going to do the platelet transfusion, only IV fluids and the paracetamol is given. And the common organism that is involved is the Aedes mosquito. This is the vector that can cause the dengue fever. The important point is the antibody enhancement that is seen with these patients. And mostly these are the important points that has to be remembered. Next, opportunistic infections. In the opportunistic infections, the most commonly this will be seen with the MTB. This is less than 500, and toxoplasma or the cryptospora, this is less than 200, less than 100, which will be mycobacterium, avium, and severe pneumocystis, which will be presentation of the opportunistic infection in the HIV patients, and also CMV. These are the findings that you are going to see. In the early, there will be presentation of the skin infections, throat infections are commonly, but most of the other will be presentation as the severe conditions of the opportunistic infections. Next, moving on to the mycology. In the mycology, the first classification will be seen with the trichophyton, and this is in the pencil shape. Here you can see this is the pencil shape with more and more macroconidia will be seen in this patient. And microsporum, this is the spindle shaped, only few macroconidia will be seen here. Whereas epidermophyton, no macroconidia, and on the microconidia you are going to see the different sizes of the club shapes that is associated with the trichophyton. In the trichophyton, the most common species that is the trichophyton rubrum is the presentation for the skin, and it can also involve the nails and hair that will be involved by the trichophyton. Next, microsporum involves the hair and skin, and epidermophyton involves the nail and skin. These are the different species of the trichophyton associated with the dermatophyte infections. And this is the cryptococcus. Cryptococcus contains of the specialized capsule which will be only positive for the negrosin stain. Negrosin stain. And this is a negative stain, and in the stain name is the India ink stain. Right? Basically, this will be most commonly coming from the bird droppings, and first presentation will be the pneumonia, and if they are immunocompromised, it can transmit to the meningitis. Next, this is the copper penny bodies or the medlar or the copper penny, and this is associated with the mostly blastomycosis. The verrucous lesions will be seen. Verrucous warty lesions will be seen. History will be the former vegetative matter infections will be seen. And next, this is the Candida. Candida is a type of yeast pseudohyphae like fungi we are going to see, and in the Candida mostly the test that is important, that is a chrome agar, this is positive, and cornmeal culture is positive for this one. Chlamydiospores, chlamydiospores also positive. Instead of the star commonly used fungi, that is the SDA, and this will be positive for the chrome agar, cornmeal agar, and also chlamydiospores will be seen in the Candida species. And Candida is commonly involves the skin and the mucous membranes, and if it is an invasive, it can involve the pneumonia or the hematogenous spread that will be seen with the Candida species. Next, Malassezia species. Malassezia species most commonly furfur or the globosa. Globosa is the most common. This can cause the pityriasis versicolor, whereas hyperpigmented or the hypopigmented patches will be seen. And if the patient is associated with the hypopigmentation the commonly we can use the azoles as a treatment of the choice. And on the test, wood lamp test, you are going to see the golden yellow color. Golden yellow color. And on the KOH mount, you are going to see spaghetti meatball appearances. Spaghetti meatball appearances that is presented with the Malassezia species. And this lymphogranulomatous lesions, this is associated with the sporotrichosis. Sporotrichosis. The history of the patients will be thorn pick. That's why it is also known as a Gardner's disease. So the pattern will be like lymphocutaneous pattern, which will be associated with this dimorphic fungi. And this is the KOH mount where you are going to see the flower-like pattern. And if you only see the lesion, if it is in the yeast shape, then it will be going to look like an asteroid body, star shaped will be seen in the sporotrichosis. So this is the different species. One is the aspergillus species and other one is the rhizopus. So this is the rhizopus species and this is the aspergillus. So the main difference between the rhizopus and the aspergillus will be if it is no septate, that is the rhizopus. If there is a septate, that is the aspergillus. Aspergillus can cause the allergic type of the pneumonia and aspergilloma, also keratitis that is seen with the aspergillus. Whereas rhizopus, it will be involving of the commonly known as a black fungus that will involve the severe patients, those who are suffering from the diabetes mellitus or patients those who are on the steroids. This is the triggering factors. So it will involve the rhinocerebral infection. Very severe infection can be seen for this patient. So drugs is commonly used for the patients of the rhizopus. We are going to use the lymphotericin B, that is can be lipoamphotericin B can be used for this patient, and also we can use the isoconazole can be used, and here the drug of the choice will be voriconazole. And the test we can do is the beta D glucon and galactomannan test can be also done for this patient. Beta D, this is done for the here also. Beta D glucon assay can be done for the candida also. We can do this test. This is the difference between the aspergillus and the rhizopus species. Next are other species such as coccidomycosis, This is the coccidioidomycosis. In the coccidioidomycosis, the presentation will be mostly pneumonia and history of the soil and travel. These are the common keywords will be given in the examination, and where you are going to see this on the examination of the microscopy, the spirules, like these spirules will be seen in the patients of the coccidioidomycosis. And this is the paracoccidioidomyces, and this is positive with the mostly South American species. South American different types of the coccidio species. This is also mostly pneumonia and the immunocompromised patients, and this sign is known as a Mickey Mouse sign. This sign is the Mickey Mouse sign that will be presented in this patient. Next, other species like this is the blastomycosis. This is the blastomycosis. This is eight shaped, right? Eight shaped or broad based yeast will be presented of this patient. Blast mycosis is commonly seen with the North America North America species. It can involve the multiple systems, pulmonology, skin, and also other systemic hematogenous species will be seen. Next, Pneumocystis zeroense. Pneumocystis zeroense is an odd type of the fungi because it consists of the cyst rather than the yeast or the mold form. This will be consisting of the cyst. And gomarin methionine stain, that is positive for the only specially for the Pneumocystis zeroense. If there is a less than 200 count of the CD4, so this is the presentation of the patient. And the drug we give is the voriconazole as a drug of the choice for the patients of the Pneumocystis zeroense. And what is this appearances is known as ping ball appearances. Next, last one, this is the histoplasma. This is the histoplasma. The presentation of the histoplasma is the blood droppings associated with the pneumonia, and the pneumonia also mostly all the symptoms like similar to the TB is similar to the histoplasma. Even in the TB can be resemble also on the parasitic of the paragnomus. All these species will be carrying the same kinds of the features with the condition. And you are going to see the spirules with macrospores that will be seen, and all these other fungi whichever not mentioned with the drugs that can be given for the itraconazole, and whichever is mentioned those specific drugs only given for those conditions. Next, coming to the parasitology. In the parasitology, first protozoa. Here you can see this is a trophozoite and the cyst phases these two. And first we are going to discuss about the Giardia lamblia. This can cause the diarrhea. Common presentation will be diarrhea, most common type overall, and this is the infective form. So the infective form will be quadrinucleate cyst. Cyst is the format that you are going to see. And the test that is positive for here is a string test. String test is positive here, and drug of the choice for this patient is the metronidazole. Can be given for this patient. And here you can see this is a strawberry cervix with discharge. So the only condition that is a protozoa associated with the STD, that is a trichomonas, and trichomonas vaginalis, which will be consisting of the only trophozoite. Only trophozoite is present. No cyst formation will be seen with the trichomonas, and partner should be also treated for this patient of the trichomonas. And mostly on the examination, you are going to see this flagellae or the hooked sucker that will be presented in the trichomonas. Next, we also have the entamoeba histolytica. Entamoeba histolytica. This will be also presented as an infectious type of the enterocolitis. RBC with cyst that is seen with the entamoeba histolytica. And also here also the drug of the choice for this patient will be the metronidazole. It can cause the lung abscess also. Sorry, it can cause the liver abscess also. Liver abscess is also same. If they are carriers, then the drug of the choice will be the paromycin. This is the entamoeba histolytica. And next, we also have the acanthamoeba. This will cause the keratitis with the history of the whole water and lens. Next, Naegleria species. This is the severe amoebic meningoencephalitis. Meningoencephalitis is caused by the Naegleria species. Next, coming to the sporozoa. In the sporozoa, here you can see this is the cycle of the malaria. In the malaria, there is a two cycles. One is a sexual and other one is a asexual. Asexual is seen in the males and in the humans, and the sexual stage and the definitive host will be the Anopheles mosquito. This is the Anopheles mosquito mostly associated with the sexual stage, and this is the main one. And intermediate host will be the humans. Host or the asexual stage is human. Right. So what is the importance of these different types? We are going to see here. The species that is common in the India is the Plasmodium vivox and the Plasmodium falciparum. So Plasmodium falciparum, which will be consisting of the severe fatal because it can involve the cerebral also. The vivax is most commonly associated with the relapse and hypnozoites that is present with the vivax. Right. Next, Plasmodium malariae. This is rare, but if it is involved, this can severely damage the nephrotic syndrome and acute renal failure that will be presented with the malaria species, and other relapses which will be associated with the ovale which will be associated with the relapse. And if you only see the single ring, that is vivax, and if you see the multiple rings, that is the falciparum. Right, this is how we are going to treat these patients. Right, next moving on to some of the findings on the plasmodium in the peripheral blood smears, that vivax can be seen with the scuffner joints, scuffner dots, whereas falciparum is seen with the Moriar's dots. Malariae species is seen with the Geman dots, and ovale is seen with the James dots. Right, next Babesia species. These Babesia species will be seen with the star shape in the plasmodium blood smear appearances, and this is associated with the tick-borne. Okay, tick-borne conditions mimics the types of the symptoms like malaria, but it is associated with the tick-borne infection. And on the peripheral blood smear, you are going to see the star-shaped appearances. You are going to see. And other conditions, here you can see this is the ascaris. Mostly fecal oral route of the ascaris will be presented, and it can cause the Loeffler syndrome. If the worms are enter into the lungs, it can cause the allergic type of the Loeffler syndrome is also seen. And this is the unembryonated egg. This is the embryonated egg. And this is how you can differentiate between the other eggs. This chitin layer will be present in the Ascaris lumbricoides. And the feco-oral route is the common pattern. Next, this is the trichoris, same feco-oral, and the egg shape will be in the barrel shape. Okay, these are the mucus plugs on the corners that you are going to see. And severe complication with this one is the rectal prolapse. Next, this is the D-shaped nucleus, D-shaped egg seen with the enterobius. And severe complications, it can be infective among the family members also due to itching and touching, and it can be associated with the appendicitis. Appendicitis presentation will be seen with the enterobius vermiculus. And next, this is the T. latum fish tapeworm. So here you can see this is the operculated egg, oval shape and broad, and B12 deficiency is commonly seen with this condition. Next, this is the H. nana, only the dwarf type of the worm that will be, and here you can see these are the plugs that will be seen with this egg. The two sides of the plugs will be seen, and these eggs will be floating. Next, this is the echinococcus. Echinococcus. The dog is the main host. The dog is the definitive host, and humans are the dead end or the host. For the humans, intermediate host will be C, and it can cause the cyst in the liver. It can involve the lungs also. What is the treatment that we can do for this patient? Pair. Pair is commonly done for like percutaneous aspiration, injection, and re-aspiration is done for these patients. Next species. Here this is the Cystosoma hematobium. This is the Cystosoma hematobium, and this is the Cystosoma japonicum. This is the Cystosoma monsoon. It can cause the GI cancer. It can cause the urinary bladder cancer, and also itching, swimmer's itch, and liver failure associated with the hematobium. Next, this is the solium caused by the pig, and this is the Taenia saginata is associated with the cow or beef. This can be like disseminated both, but the solium can be involvement of the neuro. Neuro involvement will be seen with the Taenia solium. Here you can see this is a neurocysticercosis presented with the seizures. So for the seizures, we can give the steroids as a treatment followed by the albendazole like eradication for the parasite. Next, other some of the organisms like Clonarchis and Opistharchis. These two species can cause the cholangiocarcinoma. Cholangiocarcinoma will be seen with this condition. Next, Eukaryaria bancrofti. This will be associated with the filaria due to Culex mosquito. So the drugs that we can give for this Eukaryaria bancrofti, a common drugs that we can give for this patient is a DVC. DVC drugs can be given for these patients, right? Next, important points like Trichinella. This can cause the muzzle infection, right? The specific test that is used is the Bachman's test. Next, Toxoplasma. Toxoplasma is due to cat feces infection like tachyzoids, and the specific test that is positive here is the Sabin Feldman test used for the Toxoplasma. Next, Leishmania species is due to sandfly involvement, and it can be visceral, cutaneous, post-Kala Azar diseases, all will be seen with the Leishmania. And drug of the choice for this patient we use is a lipoamphotericin B is a drug that we can use for this patient. And trypanosoma species that is associated with the Tessi fly, and also some of them can be caused by the triatom fly. Both are blood infections related to the trypanosoma infections. So these are the basic, some of the important points that can be revised for the last revision. So those who are new to this channel, please do subscribe and share with your friends. And you can join the below link with the Telegram where you can access for the notes. So until then, happy preparation guys. See you again in the next video.